My name is Tori Swindle, and I'm going to be showing you how to insert an IV, give medications, and DNC an IV catheter. I'm checking my physician's order from Miss Sally Rose. She has ordered Lasix 20 milligram per milliliter and Rocephin 1 gram per 100 milliliters, normal saline, so we're going to have to start an IV catheter. She has no known drug allergies, no medical history. Her lab work, there's some that came back normal, but her white blood count was elevated, and her vital signs were taken at the beginning of the shift, and it was normal. So I'm in my supply room, and I'm going to perform hand hygiene. Make sure that it's all nice and dry. I'm going to gather my supplies, which is my IV start kit, my Insight Auto Guard 22 gauge needle, 10 milliliter of syringe, and my extension kit, and also my towel to drape under the patient's arm. Knock in the bedroom. Hey, Miss Rose, my name is Tori Swindle, and I'm going to be your nurse today. Perform hand hygiene. I noticed on your chart that you have no known drug allergies. I just want to double make sure that you are not allergic to shellfish, iodine, alcohol, or latex. Okay, can you tell me your name and date of birth? Thank you. Okay, your medical history says none, but I got to make sure you haven't had a CVA, you haven't had an AV shunt put in for dialysis, chronic heart failure, or mastectomy done. Okay, good. Well, the doctor has ordered you some medication, and we're going to have to start an IV on you. Have you ever had one before? Okay, good. Well, I'm going to raise your bed to the level where I can see, and I am going to go ahead and put this towel underneath your arm. Going to disinfect my station. Let it dry. Put on my drape. Get my supplies out. Transparent dressing. Alcohol prep. Tourniquet. Tape. Discord. Got my extension. .22 gauge catheter. And I'm going to check to make sure that the catheter is intact, there's nothing missing. And I'm going to slide it back on, but not going to lock it. And then my 10 milliliter syringe. Okay, we're going to start getting this together for you. Before I do that, I'm going to check for jugular vein distension, and there's none. Listen to her heart sounds and breath sounds. Lung sounds are clear. Now I'm checking the vein just to make sure that I found one that I'm able to work with. Now I'm going to apply my tourniquet and make sure that it is 4 to 6 inches above where the insertion site's going to be. I'm going to tell her to open and close her fist just to make the IV pop out even more. And since then, I'm going to don on gloves. little prep pad. And clean the site, going in circular motions. And while that is drying, I'm going to release my tourniquet, make sure that I'm not touching the IV site. Form hand hygiene again. Gonna open up my extension set. And with my extension set, I'm gonna make sure I'm not touching on the inside or the inside right here because they're both sterile and you don't wanna break sterility. Gonna loosen my top. Gonna take off my sterile cap. Press it in. And I'm gonna prime it just a little bit just to make sure that there's no air bubbles and everything's fine. Place it back in its little cubby. The way it seems, this side is dry, so I'm going to reapply my gloves. Okay, going to reapply the tourniquet and pull tight. And pull through. Okay, I'm gonna grab my, before I do that, take off my gloves. And form hand hygiene. And since I cleaned my table, I'm gonna go ahead and tear my teeth. Put it on my bedside table. I'm going to reapply my gloves. Having a little bit of glove problems. They need to make gloves for bigger hands. Okay, Now I'm going to grab my catheter. Just double check everything again. I'm going to taunt the skin with my non-dominant hand. Hold the catheter 10 to 30 degrees at an angle, and I'm going to insert in. Observe for flashback, and there's flashback, so I'm going to go 1/4 of an inch in, and then I am going to push the catheter in. Going to release my tourniquet, apply pressure, take needle out, activate safety, and drop it in the sharps. Or if the sharps is not there, I would have to wait until I get done. Well, now I'm going to grab my normal saline, twist it in, going to relieve pressure, and I'm going to flush it. Okay, set this to the side. And then I'm going to grab my tape right here, and I'm going to secure my hub. Since my hub is secured, I can grab my transparent dressing. And it's going to go over the IV site. And I've got it date, timed, my name, and the size gauge that it was. And now I'm going to lock my saline and take off my flush, wrap it around here, and tape it. Clean my supplies up. And discard. Take off my gloves. Form hand hygiene. Alright, I'm going to lower your bed to it's safe and your call outs where you can reach it. And if you feel any pain, swelling, or if it's bleeding, call us to let us know, okay? And I'll be back here in a few hours to give you your medication when the pharmacy gets it put in. Before I leave the patient's room, I'm going to document that at 6/10/2020 at 2100, BD Inside Auto Guard 22 gauge inserted into left hand times 1 attempt using a tourniquet connected to the saline syringe extension tubing. Blood aspirated and flushed with 10 milliliters of normal saline. No signs, symptoms, infiltration. Secured catheter hub with clear IV tape. Dress site with transparent dressing and secured tubing with clear tape. Patient tolerated the procedure without pain and anxiety. Instructed the patient to let staff know if IV site becomes painful, red, swollen, or has drainage. Alright, it's been a couple of hours and the pharmacy has gotten Miss Rose's medication ready, so I'm in the medicine room. I'm going to perform hand hygiene. I'm checking my NUR to make sure that I have the right medication. Lasix 40 milligrams per milliliter and only need 20 milligrams. Expires 6/30. I have my primary tubing, my secondary tubing, my normal saline that expires 6/30, and my Rocephin 1 gram per 100 milliliters. That expires 6/30 also. Gonna grab my supplies also, my syringe and my alcohol swabs. My drape, just so I have everything to put on my bedside table. Alright, I'm gonna get my primary tubing out. Straighten it out so there's no kinks. I am going to prime it. Gonna have my roller clamp down and letting this go in the sink, just letting a couple of drips through so there's no air bubbles, and I'm going to roll it back up and lock it. And it's got a sterile cap on it so it's not breaking sterility. I'm going to grab my secondary tubing and going to unravel it. Make sure there's no kinks in it. Grab my Rosifin and I'm going to spike it. Put the roller clamp down. Float into the sink. Make sure all the air bubbles out. Roll it back up. And it also has a sterile cap on it also. With my syringe. Going to open it up. My alcohol swab. And I'm going to clean my cap for about 15 seconds. And poke it in. Add some air to it. Pull it up. And grab my saline, well, my Lasix. And since it's 40 milligrams per milliliter and we're only needing 20, I have 0.5 milliliters. Okay, I'm going to slide it back on my cap. I'm doing my second check. I've got my syringe noted that it's the Lasix 20 milligrams per milliliter. I'm going to recheck my Rosifin, 1 gram per 100 milliliters. And I'm going to go ahead and put it on my IV pole. Tube it around. My normal saline. Put it on. Put my tubing around. I'm going to gather my supplies. Knocking on the door. Hello, Miss Rose. How are you doing today? Well, the pharmacy called us and we've got your medication in. Is that fine with you? We're going to be going and giving your medication. From hand hygiene. gonna put my drape. Okay, I'm gonna check in my drawer in the bedroom, and I'm gonna grab my 3 milliliters of saline. They had some extras laying in the room, so I was able to do that. Now that I got everything set up, I'm going to apply on my gloves. Alcohol swab, and I'm going to clean my port for about 15 seconds. I'm going to grab my first 3 milliliter of saline. I'm going to push it in and twist. And before I push it in, I'm going to unlock it. And we're going to flush it in and discard. Wipe down my port again. And going to take off this and press down. And with this, I'm going to push 1/4 of it every 15 seconds. Just slowly in while I'm watching my watch, just to make sure it all goes in. Clean my port again. And this time, with this 3 milliliter flush, I'm going to press it in as slow as I did putting in the medication. You want it to go the same route so that it flushes through the whole thing. Re-clean. Now I'm going to clamp it. All right, Miss Rose, we're going to start your IVs, okay? Tubings. I'm gonna do my Y port on here. So my secondary will flow, my primary will stop. I took my sterile cap off, and I am going to put my tubing on. I'm pressing in, making sure that it stays. Unclamp my saline lock. And now with this, I am going to roll this down to have it unlocked, and this one down to have it unlocked. And I'm going to squeeze, and I'm going to watch the drip factor, and the drip factor was 15 seconds per milliliter. So with 100 milliliters, it's going to be 25 drops per milliliter. So I'm watching, timing this, and everything is going through. I'm gonna take off my gloves. Throw away, discard my supplies. All right, Miss Rose, we've got your IV setting in, and I'll be in about an hour to take out your IV. We've got to let this medication run in, but after the medication runs in, we'll be able to take your IV out, okay? Are you feeling any pain? No? Okay, I'm just rechecking her wristband, and everything lines up. I checked it before we administered the medications. She had her medications put in at 10:30 on 6/11/20, and it was Lasix 20 milligrams given, IV push, and Rosifin 1 gram 100 milliliters with normal saving giving. The drop factor is, the drop rate, with it being drop weight, is going to be 25 drops, and if it would have been on a continuous, it would have been 100 milliliters per hour. I've got the bed in lowest position. I got call light in place, and she has been educated about if she starts having sudden pain to let us know.